Hi, my name is Brianna Patacini, and I'm one of the clinical pharmacy specialists at Providence Medical Group Endocrinology East. And today I'm going to be talking to you about diabetes technology. To start off, we're going to talk about measuring glucose levels. So with traditional glucometers, there are many options or features that could be helpful, such as Bluetooth syncing to a phone app for tracking purposes, or features like audio that help a patient with difficulty seeing a meter to hear their glucose reading. But today I'm going to focus more on technology called continuous glucose monitoring, which can provide information in real time throughout the day and reduce or eliminate the need to do finger sticks. Most continuous glucose monitors, or CGMs, consist of a thin, flexible sensor filament wire that's inserted underneath the skin. And then on top of that is an adhesive and a transmitter that is adhered on top of the skin and stays in place for 7 to 14 days, depending on the device. The transmitter sends glucose levels continuously to a receiver or a phone app every 1 to 5 minutes. And then that glucose level is visible with the current reading, as well as the trend line of past data and the trend arrow with predicted glucose. So unlike a finger stick, which is a snapshot in time, the CGM can provide a wealth of information about glucose throughout the day and night. It's more complete and dynamic. Those trends can show you what's happening in real time with differences in food, with differences in activity, as well as different doses of medications. And it can, in some systems, give you an alert to warn of impending low or high blood sugars. It does have one good benefit for many patients in that it requires less pokes, so less finger stick tests to get that same information. It is important to note that CGMs are measuring something different than what the finger stick is. So a glucometer, you're checking the blood level in the fingertip, versus this is looking at the fluid between the cells underneath the skin where it's placed. So that does mean it can read a little bit different, and that's okay. The numbers are really, you're getting more information from the CGM, and it's more complete with trends as well as what's been happening, versus a finger stick that's just telling you what is happening right at the moment where you test. There are some disadvantages to the continuous glucose monitors, and those are typically around expense. These can be quite expensive, and they can be difficult to get covered by insurance. Generally, personal use CGMs, which are the ones that you own and are able to use continuously, so multiple sessions, they are covered in patients on multiple daily doses of insulin, and they may require frequent monitoring for insurance to cover. The important thing to know, though, is even if it is covered by insurance, it may still be expensive and not be affordable. So it really depends on your insurance. If the continuous glucose monitor for personal use is not something you want or are able to get, your provider may have a professional version that allows monitoring for one sensor session to help review for patterns. This is usually placed in the clinic. You wear it for the duration of the sensor session, and then you come back in to have that data uploaded. Sometimes you can see that information while you're wearing it, and sometimes you have to wait until you come into clinic to see it when it's been uploaded so you can review patterns with your provider. Ultimately, the choice of CGM really depends on insurance and patient preference. Other factors, of course, include if you're trying to pair it with another piece of technology that you need a specific CGM for, the cost of the CGM. Some of them are more expensive and some of them are lower cost. The complexity of the device, depending on what it takes to set it up, to wear it, to use it, to share data. And then the other thing to think about is the ability to have alerts. So some systems are able to alert for low blood sugars, which can be really important for people that have severe low blood sugars, or if they have a history of not being able to feel symptoms with their low blood sugar, so can't recognize when it's happening. A CGM can be really helpful to help recognize that and treat it appropriately to prevent a severe low blood sugar event. The other thing to think about is how to share the data. So some of them you're able to share it just directly through the phone app by sending a link or accepting an invite. Others you have to actually use USB cord and upload to a computer to be able to share. So thinking about what's going to make the most sense, especially in these times when we're doing virtual visits, that the providers can also see that information and help make your visit go more successfully. There are multiple continuous glucose monitors available. I've listed the most common ones here. I'm going to talk a little bit more about the Dexcom and the Freestyle Libre sensors in depth, as they're more commonly used in my practice, but it's important to note that Medtronic Guardian Connect does also have one. It's a 7-day sensor. And then Eversense is a little bit different in that it's an implantable sensor. So it stays in place underneath the skin for 3 months, 6 months, and potentially in the future up to 1 year once that is approved. Both the Medtronic Guardian Connect and the Eversense currently require calibration, versus the Dexcom and the Freestyle Libre are factory calibrated, meaning you don't have to do any finger sticks to calibrate the system. And because of that, as well as some other logistics around the use of the Medtronic or the Eversense, they have not been as commonly preferred by patients in my practice. So the Dexcom G6 CGM provides continuous data that's pushed to an app or a receiver every 5 minutes. It does not require a user interaction to gather the data, but the receiver or phone must remain within 20 feet to get the signal continuously. The data is sent to either a phone app, to a smartwatch, to an integrated insulin pump, or to a receiver. And you can use 2 of these together, so like the phone app and the receiver, or the phone app and the insulin pump. The phone apps are the Dexcom G6 Mobile, which is the real-time data and alerts that's happening as you're wearing it. The Clarity is the reporting app, so stores all of the information that has come across on the G6 Mobile app. And then Follow is an app that can be used by a family member, a friend, or a caregiver so that they can see your Dexcom G6 data and alerts remotely on their own smartphone. The Dexcom also has customizable alerts for low blood sugars and high blood sugars to help in making treatment to try and prevent those from becoming more severe, as well as that it has an urgent low blood sugar alarm that cannot be switched off, that helps to alert if your number is going to 55 or is at 55 or lower. The Dexcom G6 sensor lasts for 10 days, and it also has a separate transmitter that lasts for 3 months. So the transmitter is reused each sensor session versus the sensor has to be replaced each time. This system is more expensive than the Freestyle Libre, so is not appropriate for everybody. The Freestyle Libre, on the other hand, has 2 devices, so the Libre 14-day and the Libre 2. Both of these are flash continuous glucose monitoring systems, meaning that the sensor must be scanned by the reader or app in order to get the current reading and the previous 8 hours of data. So in order to capture 24 hours of data, it must be scanned at least every 8 hours, though more frequent scanning is okay too. Differences between these, so the Libre 14-day has been around a little bit longer, so it's been approved as a phone app for both iPhone and Android. That's the Libre Link app, and then Libre Link Up is the app for the family, friend, or caregiver to be able to look at. The Libre 14-day has no real-time alerts, so it can't warn a patient of high blood sugars or low blood sugars. It only can show you of what the number is when you scan it and what the data has been before that. The Libre 2, on the other hand, is newer on the market, and it just had its phone app approved for iPhone, not yet available on Android. And it does provide real-time alerts about lows or highs. So if it goes off, the user does still need to scan to get the actual information and the preceding data, but it's able to alert that there is something going on. The sensor lasts for 14 days for both devices. It is significantly lower cost than the Dexcom, probably about 3 times less expensive. But you do need to scan to get that data. That flash memory on that sensor, which is an all-in-one sensor and transmitter, holds only 8 hours of data. So if you don't scan that often, it will be missing gaps in that 24 hours. Additionally, the Libre can be impacted in terms of accuracy by vitamin C and aspirin. Some other things that are a little bit different between these 2 devices: the Freestyle Libre, it's recommended by the company to wear on the back of the upper arm, versus the Dexcom is recommended to be worn on the abdomen. It is used in other spots successfully, so it's something that really depends on talking with your provider to decide what is best for you. Next, we're going to talk about injecting insulin and some of the technology for that. First up is the INPEN. It is a smart insulin pen that's paired with an app. It can be programmed to recommend set doses or based on carbs in the meal, as well as a recommendation for extra fast-acting insulin based on the glucose reading if the user uses a correction scale. So this is the dose calculation for mealtime insulin that it can assist with. It also can track those insulin doses, and it can track how much insulin is still working. Insulin typically remains working in your system for about 4 hours. So this can help determine a correction between meals without increasing your risk of low blood sugar from stacking the insulin. The INPEN works just like a typical insulin pen, but does dial in half-unit increments to deliver the insulin. It works with cartridges, so you can use it with Novolog, Fiasp, or Humalog. The tracking of the doses can be helpful in remembering if you have actually taken your dose for the meal or not. But you can also set reminders and alerts to help kind of with that taking the medication consistently. You can track your long-acting insulin, but it's not actually paired to the INPEN app. So it's just manually tracking. The app can also be paired with a CGM, such as the Dexcom or the Medtronic Guardian Connect, and you can generate reports with these for personal or for your healthcare team to review. The BIGFOOT Unity system is a new system that's been approved in the US, but is not yet readily available. So I actually have not seen it in practice yet. I would expect to see more of this in the coming months, so I decided to include it in this. This system uses a smart insulin pen cap. It's actually using a technology that's been around a little bit longer called INSULIN pen cap that was used to help track when the last dose was given, but had no connectivity to apps or sensors. What these caps do is they just fit onto any major brand of insulin pen that's available in the US, but then are being connected to that BIGFOOT Unity mobile app. There's one cap for your long-acting insulin, one cap for your rapid-acting insulin. The rapid-acting insulin pen cap can actually connect to the Freestyle Libre 2 CGM system and can be used to scan the sensor and get that information right there on the pen cap as well as in the app. The app is supposed to provide dose recommendations based on the settings from your healthcare provider's instructions, as well as the glucose reading. But when I reviewed the information, it didn't have specifics about that app, so I'm not exactly sure how it's going to do it, if it'll look like the INPEN or if it'll be a little bit different. And then the last is insulin pumps. So generally, some things to know about insulin pumps. These use a rapid-acting insulin to deliver both basal, which is a continuous infusion of rapid-acting insulin throughout the day. And then they also can be given in bolus doses to cover meals or correction. Generally, they require more intensive insulin use, and for most pumps, carb counting is important for optimal benefit. There are some considerations with when to use an insulin pump and when not, based on kind of the minimum insulin delivery as well as the maximum insulin that can be held in an insulin pump and how often it would have to be changed. The first one is the Vigo. This is a patch pump. It uses a set basal rate, and then it also includes boluses that you can push a button to deliver in 2-unit increments. This pump would last for 24 hours, so must be changed daily. And it doesn't really use any of the carb counting or have an app to necessarily go with it. So it does not require as intensive insulin use as other pumps would. The Omnipod is a pump that is currently not integrated with CGM, though it is in the approval process for that. It's a little bit different than other pumps in that it's a tubeless pump, so it's kind of more like the patch pump, but has basal rates that can be set throughout the day and can vary, as well as can deliver boluses in really small increments to be able to more fine-tune diabetes management. It does work with carb counting and correction dosing based on the blood sugar. And it can be used side by side with a CGM. It's just not, they don't talk. The last kind of level of insulin pumps is the hybrid closed loop. So I glossed over, there are other pumps that kind of fit into this that are between that integrated with a CGM and not integrated. But this is the highest level of kind of the pumps currently available. So it's integrated with a CGM and it's able to adjust based on an algorithm, taking that CGM data to help it decide if it should reduce or raise the insulin delivery to help with high and low blood sugars. The Tandem t:slim Control IQ and the Medtronic 670G and 770G are examples of these. The last I wanted to talk about is apps and websites. So in addition to devices, there's also technology to help with diabetes management in the form of phone apps and websites that provide information as well as help with making diabetes management decisions or tracking health overall. There's many apps available, and this is only a few of them. So you can find one that does many of the things that you would find most helpful in managing your diabetes. Food databases can be great, but just caution with user-entered nutrition facts like on MyFitnessPal that it is actually accurate. Calorie King is another one out there that's not user entry. There are apps that work with other diabetes technology like CGMs, pumps, and smart insulin pens. And then of the apps that I included, so My Sugar and Glucose Buddy are two for tracking. You're able to log blood sugar, food, insulin dose, or medication activity, as well as some notes. The Tidepool and Gluco are two that allow syncing of diabetes devices, so CGMs, pumps, glucometers, and is able to also allow logging on top of that of what's going on with medications or food or anything like that. And then Diabetes M is kind of like the INPEN, but not connected to an insulin pen. It allows logging similar to the others, but it also has a bolus advisor to help with dose calculations based on carbs, glucose, and how much insulin is still active. And then as far as websites, so the American Diabetes Association and the CDC have a wide range of information and resources on their website. The ADA has a consumer guide that talks about different meters and technology that's available, as well as medications and assistive devices. And then the last four are more diabetes online community resources. So they have news, they have reviews talking about research or things that's happening, as well as what living with type 1 or type 2 diabetes is like. There are ones that are geared more towards type 1 diabetes, as well as some that have resources for both type 1 and type 2, and some that are probably geared a bit more towards type 2 diabetes. That concludes my presentation. Hopefully you've learned some about some diabetes technology that could help you in managing your diabetes. Thanks.